Good to have you with us on this Friday morning. I'm Joe Fryer.
And I'm Savannah Sellers. We're going to begin this morning on Capitol Hill with that highly contentious hearing on the nation's public health. So senators from both sides of the aisle grilled Health Secretary Robert F. Kennedy Jr. about everything from his guidance on vaccines and his decision to pull funding from vaccine research to his firing of CDC Director Susan Benares.
Kennedy was unable to provide answers to some pretty basic questions about the COVID-19 vaccine, including questions from a few Republicans who actually voted to confirm him a few months ago. He repeatedly made false and misleading claims about vaccine safety and the number of deaths from coronavirus, as well as the role the CDC played in mistakes that were made during the pandemic response. At times, Kennedy got into shouting matches with lawmakers as he defended his dismantling of key parts of the agency, calling the CDC corrupt. He also accused some lawmakers of accepting money from pharmaceutical companies. Here's some of what we saw yesterday.
I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency.
Would you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that.
Robert Kennedy has elevated conspiracy theorists, crackpots, and grifters to make life or death decisions about the health care of the American people.
Do you believe COVID-19 was politicized?
Yeah, the whole process was politicized. Senator, I mean, we were lied to about everything.
Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
Okay, then let me ask, because you also
Senator, I just want to make clear, I did not say that.
An email from a physician friend of mine. Hey, Bill, I'm not even sure what I'm asking you, but we're all confused and concerned about who can get the COVID vaccine. I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
When have you produced the data that you relied on and that this FDA relied on to change those parameters? You did it behind closed doors.
No, the data is all
parents,
public.
now parents who decide that they do want their children to have
You're just
COVID
making
vaccine
stuff up, Senator.
I'm not
You're
making
just
stuff
making stuff up.
You know, sometimes when you make an accusation, it's kind of a confession, Mr. Kennedy.
NBC News medical analyst Dr. Vin Gupta is standing by with reaction from the medical community. First, let's go to our Capitol Hill correspondent, Melanie Zanona, for more. Mel, good morning. So this hearing went on for 3 hours, and we saw what you would call a rare moment of bipartisan backlash against Kennedy, against some of his policies, the people he appears to be surrounding himself with in lieu of scientific experts who are respected by the mainstream medical community. For lawmakers, just what seem to be the most central issues here?
Well, I would say the overarching concern of that hearing yesterday from senators on both sides of the aisle, we should mention, was the policy that has been instituted towards vaccines. And they drilled in on a number of different issues that they say are extremely concerning towards them. One of them being the CDC's decision under Kennedy's watch to cancel research for some critical vaccine research that contributed to the creation of the COVID vaccine under Trump's first term. They also were really concerned with the changing recommendations for the COVID vaccine and arguing that this has really limited availability in a number of pharmacies. Kennedy tried to deny that, but no doubt it is clear that because of these changing recommendations, these changing policies, it is having a real impact on people's day-to-day lives when they go to the pharmacy. And finally, they also really raised concerns about some of the personnel shakeups, not just the firing of the CDC director, but also this key advisory board. Kennedy promised that he would not touch that board, this board of people who make recommendations about vaccines. He promised that when he initially got confirmed, but when he got into the job, he actually fired that entire panel and replaced it with vaccine skeptics. And so there's a lot of concern about what that panel is going to do going forward in terms of recommendations not just about COVID, but about other critical vaccines. So it was certainly a bipartisan grilling from both sides of the aisles yesterday.
Mel, Kennedy appeared to strike a different tone at this hearing, specifically when it comes to these vaccines. So he told Colorado Senator Michael Bennet, for example, that vaccines developed with mRNA technology, of course, that was used for these COVID shots, that they cause serious harm and death. That's something that's not supported by clinical trial data or the scientific community. And obviously, people try to get answers out of him on that. At the end of the day, was the health secretary able to back up any of the drastic changes that he's made to vaccine recommendations or to the leadership at the CDC?
Well, certainly not to the liking of the scientific community or the senators that were grilling him at yesterday's hearing. I mean, he really struggled to answer some basic questions, particularly as it relates to the COVID vaccine. He struggled to back up a lot of his assertions. He continued to say misleading things about the vaccines. So overall, I would say there was a lot of unhappiness with his performance. But we should point out that performance yesterday was for an audience of one, and that is President Donald Trump, who likes to see fighters. He likes to see people combative with members of Congress. So while it may have not been satisfactory for the senators or the scientific community, certainly that was a pleasing performance for President Donald Trump.
And some of those Republican senator questions were also clearly for an audience of one as well. So, Mel, ahead of this hearing, the former CDC director, Susan Minares, published an op-ed in the Wall Street Journal accusing Kennedy of politicizing public health. She wrote that before she was fired, she was, quote, told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric. Kennedy was asked about this. He spoke about her firing at the hearing. What did he say in response?
Well, he was completely combative and defensive. And in fact, he denied that that meeting ever took place. He said he's never had a private one-on-one meeting with the CDC director. And then he defended the decision to get rid of her. He said that his goal stepping into this role was to restore the trust and credibility at the CDC. He talked a lot about the missteps that the CDC made during the COVID era, some of the things that they recommended that later turned out to be perhaps unnecessary, and really used that as his argument for why some of these people deserve to be ousted. But we should point out that the CDC director was just confirmed this summer by the Senate to that role as CDC director. She was not the director during the COVID year. So clearly she had enough confidence from President Trump to be nominated to that role in the beginning. So just an extremely combative defensive performance from the secretary yesterday.
We also discussed this, reported this earlier this week, that over 1,000 staff members at the CDC, they're calling for Kennedy to step down. Georgia Senator Raphael Warnock told Kennedy, right to his face yesterday that he should resign. Are there any signs that his future is in jeopardy? Or, as you point out, is that audience of one still happy?
Yeah, well, at this point, there are no signs that his job is in jeopardy, despite the fact that there were some really sharp and pointed questions from Republicans, several of those Republicans being doctors, raising concerns. None of them actually went so far as to say that he should step down. And perhaps most importantly, as we were talking about, Trump seems to still have confidence in his secretary. Just listen to Trump last night talking about the hearing.
He's got a different take, and we want to listen to all of those takes. But I heard he did very well today. But it's not your standard. It's not your standard talk, I would say, and that has to do with medical and vaccines. But if you look at what's going on in the world with health, and look at this country also with regard to health, I like the fact that he's different.
So at this point, Trump expressing confidence in the secretary, which means his job is safe, at least for now, guys.
Mel, thank you so much. Appreciate it.
Well, for more reaction from the medical community now, let's bring in NBC News medical analyst Dr. Vin Gupta. Dr. Gupta, always great to see you. Let's start just with your reaction as a doctor to some of the claims from yesterday. Specifically, I want to talk related to vaccines and some other common medical treatments like antidepressants that were made by Health Secretary Kennedy yesterday. How would you characterize his views?
Well, Savannah, Joe, good morning. I'm taking this from an ICU on the West Coast. And so I've had a chance to confer with a lot of my colleagues in the medical community across the country to a T. We all think it's dangerous and delusional. And I'm embarrassed for the Secretary of Health. And here's why. He's linking mRNA vaccine technology, Savannah, to the onset of the chronic disease epidemic, as though it happened just a few years ago, which is absurd. This has been something that's been at play for the last 80 years. It's getting worse. It's a real problem. We have to tackle it. It has nothing to do with vaccines. Antidepressants, he wants to link to mass shootings. There is no link between the two. It's laughable, but it's tragic because he's a leading health official. And it's distracting us from real, actual health problems here. But his views are not mainstream, but that misses the point. 79 medical societies have rebuked him. He does not have the trust or the respect of the people he needs the most to trust and respect him, and that's healthcare professionals.
We want to play a moment that maybe didn't get as much attention as some of the others, but it was between New Mexico Democratic Senator Ben Ray Lujan and Kennedy. He was asking Kennedy about this $50 million study that's trying to understand the possible causes of autism. Let's listen to that. We'll talk on the other side.
You said that you're soon going to release a study claiming to reveal the cause of autism. As you know, autism affects millions of children, so I guess you'd have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct this study. Is that correct?
No.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting a study.
Is Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
He was charged by a medical board. He sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot.
So, Dr. Gupta, when you hear something that's someone with a medical background or yourself, what's the conclusion you draw?
I mean, Joe, this is symptomatic of everybody that is populating the upper ranks of the HHS, whether it's leading the this new autism research, or whether it's leading the FDA or the NIH. These are people that don't actually care for patients or pretend to, and they're making big decisions. And how can you have humility? Medicine is the art of, frankly, just operating. It's the art of medicine. There's some things we know. There's some things we have to use our judgment. But if you don't know and you are not a professional and trained in that space, how can you possibly make decisions that impact millions of people? He has charlatans in these positions. I mean, that just proved it, that discussion there. And of course, that's a continued source of worry.
Kennedy's revamped CDC vaccine panel is expected to meet on September 18th. It's coming up. What are the potential implications of that meeting for things like future access to vaccines, how insurance covers them? What is this meeting supposed to be for?
Well, again, this meeting typically in most normal Democratic and Republican administrations, this meeting is meant to just issue typical standard recommendations from the Advisory Committee on Immunization Practices that then the CDC endorses. And then to your point, insurance companies then say, okay, we're going to cover that as we always cover it for patients across the country, depending on what insurance they have. Because there's an uncertainty now injected, this advisory committee has enormous power. They can say, we're not going to cover the COVID vaccine for certain age groups. That's going to have impacts on who has to pay money for it if they want to get it versus who doesn't have to pay money for it. Huge impacts. By the way, pharmacists across the country, most Americans actually get their vaccines at pharmacies across the country. Pharmacists cannot do something that this advisory committee does not endorse because there's strict rules there in terms of their scope of practice. So the pharmacists down the street, Savannah, may not be able to do what they typically do based on what this advisory committee says. People will probably have to pay out of pocket that usually did not have to for these vaccines. And I'll just say, they've signaled, Senator Rand Paul, others at HHS have signaled perhaps hepatitis B vaccine might be next for reasons, I have no clue. There's no scientific reason why we would be revisiting hepatitis B vaccine for a pediatric population. No other country in the world is doing this. Here we are having these types of conversations.
Dr. Gupta, thank you very much. Your expertise appreciated this morning.
Later today, President Trump is expected to sign an executive order to rebrand the Department of Defense.
The president's directive will add Department of War as the secondary title of the Defense Department. That is according to two White House officials.
NBC News senior White House correspondent Garrett Haake joins us now with more on this. So, Garrett, what are we learning about why the president's expected to rebrand the Defense Department? I mean, in reality, what does it actually mean? Is this marketing or is it something else?
Yeah, look, Joe, this is a little bit less than meets the eye in terms of this executive order. The president is essentially setting up Department of War as a nickname for the Pentagon and saying that Pete Hegseth and other officials there can use Secretary of War and related titles while they seek to have the name changed through Congress, which is the only way that you can actually change the name of a cabinet department. But the president's been pretty open about this. He likes the branding. He thinks Secretary of War, Department of War sounds more martial and strong. And so that's the way he wants to brand it for the time being. But again, it's really just a nickname signed on a piece of paper today.
Garrett, we also want to ask you about some other news here. This has to do with a conversation that's been happening quite a bit, the National Guard in D.C. So now the District of Columbia has filed a lawsuit against the Trump administration for doing that, for deploying the National Guard. What's being argued in this suit, and how's the White House responding?
All of this is particularly confusing because of the unique way in which D.C. is structured. Here you have an elected attorney general who represents the district in lawsuits and handles some of the criminal cases here in D.C., filing this lawsuit saying that the deployment of the Guard here is illegal, that it shouldn't be done, and that it should be a message to the rest of the country that it can happen here, it can happen elsewhere. That's not exactly right in terms of how the Guard in D.C. is actually structured, and D.C.'s mayor is notably not really a part of this lawsuit. She's been praising the way that the crackdown on crime here has so far kind of worked in the District of Columbia. And so you've got a situation where the White House says this is a distraction. They believe that they will ultimately win this lawsuit and that this is essentially a political move by an elected attorney general here in the district.
Garrett, we understand that the immigration detention facility that's located in the Florida Everglades, known as Alligator Alcatraz, has gotten a lot of attention. Now it is expected to remain open, at least for now. That's because a federal appeals court put on hold a lower court judge's order who said shut down operations there. So we got a lot of back and forth here legally. What's the latest? What can you tell us?
Yeah, I mean, you pretty much have it here, Joe. This original lawsuit that went before a federal judge basically said that this facility didn't meet environmental standards. It wasn't properly reviewed. The first district judge in Florida said, all right, we're going to shut it down. Now the appeals court here says we can leave this facility open while the case continues. The White House is touting this as a victory. They think this was a sort of a pretext, this environmental case, to try to shut down an immigration policy that some folks in Florida don't like. Regardless, this facility will remain open in the interim while this case proceeds.
All right, Garrett Hake, lots to cover this morning. Thank you.
Well, in a series of rare interviews, a dozen federal judges are speaking out over their frustration with the Supreme Court.
10 of these 12 judges told NBC News that the Supreme Court needs to explain its rulings better, specifically when overturning contentious lower court rulings involving the Trump administration. Some of them say they worry that the practice is undermining the judiciary system at a sensitive time.
For more on this, let's bring in NBC News senior Supreme Court reporter Lawrence Hurley, who's done fantastic reporting here. Lawrence, good morning. Thanks for joining us. So these judges interviewed, they pointed to a pattern they say has emerged between the Trump administration and the Supreme Court, with one of these judges calling this pattern inexcusable. Walk us through their concerns here.
Yeah, I mean, as you just heard in the last segment, there's so many of these cases coming up where courts are intervening to block Trump administration policies that are themselves, because of Trump's aggressive use of executive power. And so the courts are stepping in. They're saying, OK, let's put this on hold while we figure out whether it's legal or not. And then the Trump administration quickly appeals up to the Supreme Court, which obviously has a conservative majority. And the court in many of these cases is then swiftly reversing the lower court, or at least putting it on hold. And in some of those rulings, which are not your traditional kind of Supreme Court cases that take months to decide and have oral arguments and long rulings, they're actually decided via very short orders that sometimes don't have any explanation of the legal grounds for why the order's being blocked. And then the case goes back to the lower courts again, and the Trump administration touts a huge victory. And this is coming at a time where lower court judges face a lot of criticism from Trump administration officials and MAGA world people on social media in quite harsh terms. And so some of these judges think that the Supreme Court is sort of playing into that rhetoric in a way by not really being careful when it's overturning these rulings. They think the court should be more careful what it says. They should be more conciliatory towards lower court judges, basically they're all on the same team. They're all part of the third branch. And they should be sticking together more, even when the court is overturning them.
As you mentioned in your reporting, emergency rulings used to be rare. They're becoming increasingly common with so many issues popping up we've never really seen before this year. These cases fall under what's known as the shadow docket. Might sound like something out of a spy novel. So first, explain what that means and how many key Trump-related cases have we seen in this docket?
Yeah, so I think just the other day we had like the 23rd Trump administration filing on the emergency docket or shadow docket. These are cases where there's not like a traditional appeal. It comes up really quickly. The court isn't hearing arguments. Then it's not sort of heavily briefed, with lawyers making all the different arguments. And then when the ruling comes out, it's not in the form of a full written opinion. And it's these cases that are at an early stage where a judge has made some decision to put a government action on hold. And the Trump administration obviously wants to pursue their policies, but the judges are saying, wait, hold on a sec, let's see if it's legal or not. So the Supreme Court then has to sort of decide at this preliminary stage of the litigation whether to allow the policy to go forward or not. And this has been a kind of recurring theme. It happened during the Biden administration too. But the rate at which the Trump administration is going to the court and the rate at which the court is granting those requests has really skyrocketed this year. I think they've granted 17 of the requests so far on a whole manner of issues about immigration, about firing federal workers, about independent agencies. We're going to see more of that in the months to come. And this is why some of these judges, are kind of raising concerns about it.
Lawrence, have any of the Supreme Court justices addressed these concerns?
Well, actually, yesterday, Justice Brett Kavanaugh, after our story was published, he was speaking at a conference in Memphis, according to reports, and he made some kind of conciliatory type comments towards lower court judges and repeated some stuff he said before about how, maybe the court could do a better job of explaining itself. But he also made, pains to say that, he thought lower court judges are doing a good job. And actually last night, Justice Amy Coney Barrett also was speaking in public, and she said, she kind of paid tribute to lower court judges too. So there's signs that, Supreme Court justices are aware that there's some concerns within the judiciary.
Lawrence, again, thank you so much for bringing your exclusive reporting to us so strong. We appreciate it.
Justices are even reading it. All right. Yeah. While the West battles a new round of wildfires, the Justice Department is suing one of California's biggest utility companies. In two separate lawsuits, the DOJ says that Southern California Edison's equipment is to blame for sparking fires, including the deadly Eaton fire, which tore through Los Angeles earlier this year. NBC News correspondent Liz Kreutz has the details.
8 months since the Eaton fire ravaged parts of East Los Angeles, killing 19 people and destroying more than 9,000 homes, the DOJ accusing one of the state's largest utility companies of starting it.
Southern California Edison negligently failed to properly maintain its power and transmission lines, negligence that had deadly and very costly consequences.
In two lawsuits against SoCal Edison, the U.S. government says they're seeking more than $77 million in damages for both the Eaton fire in Altadena and the 2022 Fairview fire in Riverside County, alleging a troubling pattern of negligence. While investigators have not officially ruled on the cause of the Eaton fire, videos like this one have emerged showing flames at the base of an electrical tower in the early minutes of the blaze.
We believe that the evidence is clear, that Edison is at fault. The reason not to wait is because fire season's coming up again. We want Edison to change the way it does business.
In a statement, SoCal Edison responding in part, while the cause of the fire is still under investigation, we will review this lawsuit and respond through the appropriate legal channels. It all comes as firefighters are actively battling dozens of other wildfires across the West, from Washington State, where the Rattlesnake Fire is burning west of Spokane, to California, where crews are gaining ground on multiple brush fires that ignited from a lightning storm outside Yosemite National Park.
Our thanks to Liz Kreutz for that report.
Well, it could be a rainy weekend for much of the country. Let's get a check on your morning news now weather.
Meteorologist Angie Lastman's following another cold front. It's either hot or it's cold, right?
Yeah, isn't it crazy how the weather works, guys? Yes, we do have the potential to see kind of some weather to interrupt those outdoor plans and switch things up. We may be feeling a little bit more like fall by the time the weekend's over, depending on where you are. Doesn't mean it's going to be raining the entire time, so let me get you some of those details. Here's what it looks like this morning. Notice this line of showers and thunderstorms. It was a whole lot more robust about 6 hours ago, working across the Northeast. That has since cleared out, and we've just got some of these lighter showers lingering across Maine. But here comes this next area that we're going to watch. We've got the heavy rain centered across parts of Michigan right now, and that's that secondary cold front that we're going to be tracking through the weekend, and really by early Sunday morning, it'll be closer to the East Coast. But between now and then, we've got a couple of pockets of rain and potentially strong storms to track. Here's where the severe storms will be later today across parts of the Tennessee Valley. And notice there's still some rain that we're going to have to deal with. And then by the time we get into tomorrow, really the second half of the day, we start to see that ramp up. The showers, the thunderstorms arrive in the Northeast, and we'll see the periods of heavy rain along with the chance for some of those stronger storms to develop as well. Here's the area we're watching for the strong to severe weather today: Nashville, Lexington, Knoxville. I'd have a way to get those alerts. Not a super large chunk of the country, but still the strong wind gusts and the hail and maybe even a couple of isolated brief tornadoes are on the table through this afternoon and into this evening. Now, switching gears, talking tropics, because we've got tropical disturbance 91L that we are keeping a close eye on, and you'll notice 90% chance of developing, and we will likely see a tropical depression by the time we get through the weekend. Now, this still has a long way to go. We're going to be keeping a close eye on that here for the next couple of days. We potentially will be watching it into next week to see how it could impact parts of the Caribbean or down the line the United States. Too early to tell on that. But we've also got Hurricane Kiko, Category 3. This is a Pacific storm that we're watching, and we'll watch this to potentially impact Hawaii down the line. Again, we've still got some time with this. Notice that's Tuesday as it's approaching, maybe Monday approaching the Hawaiian Islands with some heavy rain. We'll see the surf be impacted and potentially some coastal flooding. But this is something that we'll keep a close eye on through the weekend as well. And last but not least, we've got post-tropical Lorena. Now, why we care about this is because it's increasing those rain chances across parts of the Southwest. We've got a flash flood risk that's marginal today across a good chunk of the country. It's that tropical moisture accompanied by the monsoonal moisture and just some daytime heating that's really going to give us the chance to see some pockets of heavy rain that could potentially impact folks' weekend plans through that region. Phew, I'm tired. That was a lot. Good job. Thanks. Not going on. Hopefully you got all that.
We got it. We got it.
I love when I learn something. See you in a little bit. Okay.
2 months after deadly flash floods swept across Texas Hill Country, today Governor Greg Abbott is poised to sign tougher regulations into law meant to keep campers safe. On the 4th of July, Camp Mystic was wiped out by unprecedented flooding. The Guadalupe River rose 26 feet in 45 minutes, killing 25 campers and 2 counselors. Now, the parents of those young campers are opening up to NBC News in an exclusive interview. NBC News correspondent Priscilla Thompson has their story.
Seal would be in 3rd grade right now, starting dance, soccer, talking about Halloween costumes incessantly. But instead, she is lost in the Guadalupe River right now.
2 months after catastrophic floods tore through the Texas Hill Country, the parents of 8-year-old Seal Stewart still wait.
Hoping and praying that our child's body to be returned to us.
Every phone call, every text, your heart stops because you hope it's the one.
Their daughter, among the 27 young lives swept away at Camp Mystic. Those parents, in an exclusive Today Show interview with Jenna Bush Hager, remembering their girls and their final letters home.
I love you. I miss you so much. I just can't wait to see you. Happy July 4th. She was happy. Just said, "Dear Mom, I'm having so much fun."
Families united in grief, now fighting for change.
This wasn't an accident. This was complacency.
Spending the week since their children's death urging lawmakers to pass the Heavens 27 Camp Safety Act, which prohibits licensing of youth camps with cabins in floodplains with limited exceptions based on level of risk. Requires camps to have an emergency warning and public address system that works without internet, and to display evacuation routes in every cabin. Camp Mystic writing in a statement, It supports the legislation and applauds the families for their meaningful advocacy and leadership. The governor says he will sign the bill into law.
We sometimes say, man, I hope we never forget about what Molly was like. And the Heavens 27 family is a way for us to never, ever let the world forget these girls.
Our girls' legacy was not that they died in vain.
Priscilla Thompson, NBC News.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.